You know, the guidelines all say that all individuals should be doing 150 minutes per week of moderate physical activity or 75 minutes per week of vigorous physical activity. Well, that's our big problem in the United States and the world, and probably here in Canada too, is that so many people are way below the federal and worldwide guidelines for exercise. So a minority are probably well exceeding. But the people who are training for ultra triathlons and marathons, they are some risk of that. And I'll just give you an example. If you study people who go and do a marathon, if you measure their blood after the race, about a third of people release cardiac troponin. That's the protein that's released and studied in the emergency room for heart attack. About a third release BNP, a brain natriuretic peptide. That's the same thing that's released in heart failure, and that's how we use this to diagnose heart failure and monitor heart failure patients. And if we do scans on the heart, about a third also have cardiac dysfunction. They dilate their chambers, particularly on the right side of the heart, and get some dysfunction of the heart, particularly in the ventricular septum and in the right ventricle. Now, fortunately, all of this resolves usually within days and weeks of doing, for example, a marathon or a triathlon. But it points out that there are potential harm, particularly for people who are doing this over and over. Now, I'm not trying to scare athletes, but I think it's worth for the clinicians and the athletes to know that there are some risks. And if they're doing this form of high exercise, they have to recognize that they're doing it for reasons beyond health, because you get the maximum health benefits from quite low levels of exercise.